To demonstrate how to start a peripheral IV using the no-touch technique recommended by the CDC guidelines. I'll begin by washing my hands with an alcohol-based sanitizer. I'll apply my tourniquet, and then I'm going to assess my vessels for my best vessel for the choice of treatment. Once I've identified which vessel I'm going to use, I'll use a local landmark, either a mole or a rash mark or whatever it is, so that I do not come back and repalpate my area. I'll apply my gloves. Now I'm going to activate my chlorhexidine or my ChlorPrep and scrub my site vigorously for at least 30 seconds. I want to make sure to get the whole area that will be underneath the dressing of my catheter. After a 30-second scrub, I'm going to allow that to dry. I'm going to prep the rest of my area, so I want to make sure the top of my no sting barrier is removed. I have my dressing prepared, a sterile gauze, my IV catheter is ready, and then I have my extension set, which is already primed and ready to go, and I'm going to leave my cap on just to keep that tip clean. After 30 seconds, my ChlorPrep has dried. I'm going to take my IV catheter, check for my landmark, and do not repalpate. So this is the important part where we do not touch the area again. I'm going to grab below my site to secure the vessel. I'm going to enter the vessel, advance my catheter. I want to make sure to use the finger of my clean hand so that I do not contaminate that area. What I want to do here is go ahead and release my tourniquet. I'm going to I'm going to grab my extension set, remove my cap. I'm going to grab my gauze and grab the hub of the catheter and compress the vessel with that sterile gauze so that I'm not touching that area. I'll remove my needle, connect my extension set, and at this point I want to continue holding on. I'm going to grab the syringe and I want to aspirate and flush that vessel. I'm going to remove that gauze. If the catheter is heavy, I'll use my hand to hold that in place. I'm going to use my no sting barrier to prep my skin around that site where the dressing will be. Again, not touching with my hand. Once that has dried, I'll grab the dressing and use that to apply over my site. So I've started that IV without going back to repalpate after I've cleansed it. It's now covered with a sterile dressing and it's ready to be used.